Imagine you're a physical therapist. You see a dozen patients a day with different conditions. A young woman comes in with radiating pain down both of her legs that she's not found relief for months. The evaluation's really challenging since she's in so much pain and she starts to cry. You spend the session talking through it with her and making a plan for the next session, yet she never returns for further care. What happened here? This was a real scenario that I faced, demonstrating how critical it is for PTs to have an array of tools in our clinical toolbox and to be prepared to use them. My education at NAU has provided me with so many, yet one missing that could have made a pivotal difference here was training in trauma-informed care, or TIC. TIC is the practice of recognizing psychological trauma in order to appropriately modify our therapeutic approach. 70% of U.S. adults experience psychological trauma at some point in their lives, with 20% of women experiencing sexual assault. The odds are high that we treat patients with a traumatic background, whether or not it is listed in their medical chart. And while our curriculum touches on aspects of childhood trauma, how to handle a patient presenting with signs of trauma in your clinic and how that factors into treating their very real bodily pain is not included. So for our capstone project, my classmate and I designed a 2-hour course for our DPT program covering just that. We looked to the literature for best practices from others who had implemented similar trainings in their healthcare education programs, although there is no research for physical therapy specifically. Our course was designed to fit into the already jam-packed DPT curriculum, to complement existing teaching methods, and to encourage interdisciplinary and collaborative care. We trained participants on key elements of TIC, including exercising universal precautions for all patients, identifying signs of trauma in individual patients, and responding appropriately through our treatment plan or recommending co-treatment with a mental health care provider. Based on our pre- and post-survey results, all participants appreciated an increased understanding of what TIC is and how to incorporate it into their clinical practice. Our course offered our peers strategies on how to face psychological trauma while providing comprehensive physical care and preventing compassion fatigue in ourselves as providers. We plan to publish these results nationally in journals and through conference presentations in order to demonstrate to DPT programs across the country the feasibility of incorporating information on this incredibly important topic. And hopefully, if any of my classmates face a situation like I did, they'll be able to get their patient the care and relief that they deserve. Thank you.